Hello everyone and welcome to AceOSCE's video for today. Thanks for joining me, Alicia, and in today's video we will be focusing on an OSCE case where we are required to talk to another healthcare professional and communicate with them. In our regular pharmacy practice, we're able to talk to a lot of patients, are able to talk to them in terms of OTC counselings, in terms of regular medication counselings, and even other questions that they may have. However, in the actual PEBC, we are also assessed on our communication skills with other healthcare practitioners. And in this video, I'm going to try to give you an idea about how we can talk to other healthcare professionals and be able to solve an PEBC OSCE case in order to get the best marks that we could. Hopefully this video helps you out, and let's get started with the case. The first thing that we usually see is a door note. In this case, it is a doctor comes to get your recommendation, do as you would in your regular practice. Now, as most of you are aware, the door note is going to be your first cue as to what the case is going to be. So in case you ever see a doctor or a healthcare professional coming in, do make a mental note or maybe just write it in your rough sheet to ask about any liver and kidney function tests. Just because they are healthcare professionals, they may have a good idea, and you could feel free to use your medical jargon. Once you enter the room, do not forget to introduce yourself, even if it is a healthcare professional. Hello, my name is Tina. I'm the pharmacist on duty today. How could I help? Hi, my name is Dr. Yusuf and I'm a resident doctor at this facility. I had a few questions about a mutual patient and I was wondering if you could help me. For sure, doctor, I appreciate you coming in and asking for my help. Please have a seat. Please let me know how I could help you today. So I do have a patient here who has epilepsy. I just wanted to make sure that I know all the rules as to what to follow and the protocol to follow in case he does come into the emergency department in the future with an epilepsy attack. He is currently stable on his epilepsy medications, but I just want to know how I could use my knowledge and use your knowledge for a future attack in case he does have an epileptic attack. That is a really good idea to know, doctor. Of course, in cases of epilepsy that could be life-threatening, knowing the protocol beforehand really does give us a heads up so we can have better chances of the patient surviving. Are there any other questions that you may have for me today? No, I think that's it for now. Okay, doctor, I would really appreciate if you could go through the profile for the patient together. Is that okay? Yeah, for sure. Perfect. So I do see a patient profile here. It says that the patient's name is Tom Jacks, who is 24 years of age. He is male and he has no known allergies. His conditions currently are epilepsy and asthma. Are there any updates to these facts as of the moment? No, those are all the current facts that I know of. Okay, I also see that he's currently taking carbamazepine 200 mg CR, presumably for the epilepsy, and a PRN salbutamol inhaler, I think for asthma. Is that correct? Yeah, that is correct. Okay, any other information, any other conditions or any other medications that I should be aware of? No, that's all that I know. Okay, and as per your assessment, his epilepsy and asthma are controlled as of right now, and he's doing well on these medications. Am I right? Yes, that is correct. Any liver function tests, any renal function test information that you may have that may help me give you a better recommendation? No, he's actually really young, so everything seems to be fine for now. Perfect. I really do appreciate you quickly going through his profile with me. That really gives me a lot of information so I can go through my reference and give you the best recommendation as per your questions. Apart from the question you had for me today, doctor, do you have any further questions? Yeah, I was also wondering if there was a certain protocol that I could skip. That is a good question, doctor. Here is my reference. I will just look through it and I'll be back and I'll give you my best recommendation if that's okay. So guys, of course, always tell the doctor or the person you're talking to, take permission from them before you go into the reference so they don't feel ignored like you're not talking to them. Also, make sure that you go through the whole reference. If there are 2 or 3 different references, make sure you go through all of them and read through everything really nicely. Skim through that, of course. You will see the answer right in front of you usually. And for maybe the second question, you may have to go through a little bit deeper. For example, here the doctor had asked us if there's some protocol that we could skip, and as you can see, the reference does say that patients can go through the phases faster and more rapidly, especially if they are sick or in the ICU. So that means they don't actually have to go through all the phases. They can only go through maybe a few phases, especially if they're very sick. Also, if you feel more comfortable, you can go back to the doctor and read out from the reference while you are talking to them. Thank you so much for waiting, Dr. Yusuf. I do have a reference in front of me. In order to answer your second question, yes, there are different phases of the protocol to be followed in case of status epilepticus, and the stages may not be 1, 2, 3, and 4 as in chronological order. Especially in patients who are very sick or who are in the ICU, there may be certain phases that may even be skipped. Hopefully that answers your second question for you. In order to answer your first question as to the protocol, I would feel more comfortable reading out through the reference so that I do not miss or omit any information from you. Is it okay if we could go through the reference together? And of course, if need be, I can give you a copy of my reference as well. Is that okay? Yes, for sure. Thank you, doctor. So as per my reference, I do see a drug table right here. It gives me different phases that a patient goes through in terms of status epilepticus treatment. The first phase that usually lasts for 0 to 5 minutes is the stabilization phase. We're of course going to be assessing their ABCs, airways, breathing, and chests. Compressions, of course, timing of seizure from the onset has to be noted. Finger stick glucose has to be seen just to get a better idea of his blood glucose levels, and IV access should be established. In the next phase, which is the initial therapy phase, which is about 5 to 10 minutes from the onset of the epileptic attack, you choose one of the following, that is IV lorazepam, midazolam IM, or IV diazepam, and in case they're not available, there are other medications that you could be giving as well. In terms of the phase after that, which is the second therapy phase, which is 20 to 40 minutes after the onset, there is no evidence to support a preferred agent out of these, but you do give a single dose of any one of the following, being levetiracetam, valproic acid, or fosfentanoin. If the agents are not available, phenobarbital, if it isn't already given, we can be giving it. It is one of the other treatments that we can give in the initial phase as well. Once the second phase is complete, the third phase starts about 40 to 60 minutes after the initiation phase. There is no clear evidence to guide therapy in this phase. It is more about the doctor's assessment, I presume. And you choose the following options, anything that you can repeat the second line therapy, or you can give an anesthetic dose of thiopental, midazolam, phenobarbital, or propofol. This should help to contain the status epilepticus attack, and as discussed, these are usually the phases that you go through, but in case the patient is really sick or he is in the ICU, the secondary phase or the second phase may actually be skipped altogether for that patient. Have I answered all your questions, doctor? Did I go too fast by any chance? No, I think I could understand everything clearly. Perfect. Would you like a copy of this reference just to keep with yourself in case you ever need it? Yeah, for sure. No, that is really helpful. Perfect. I did go through the reference really quickly, but giving you a copy is going to make sure that you can go through it in your own time. And of course, if you have any further questions regarding this reference, feel free to call me and I can definitely guide you. If you want to come in person as well, we are always here for you. In case you have any further questions, don't hesitate to call our pharmacy and we would definitely be able to help you out. I would also suggest maybe in terms of his asthma, giving him some sort of maintenance therapy in case he's using more than the required number of puffs of salbutamol each day. It would be a good idea to keep him on some sort of maintenance therapy if you think so. And is there a reason why you thought that this patient could actually have a status epilepticus attack even though he is on maintenance epilepsy therapy? Well, I just wanted to keep in mind, just because I did see another patient having an epilepsy attack who was on epilepsy medication for maintenance, so I just wanted to make sure that I was aware of the protocol. No, that is a really good thing, doctor, to be sure about what to do in case such a thing happens, especially things that are life-threatening like epilepsy. Again, I will give you a copy of this reference, and if you have any questions, do feel free to give us a call. Perfect. Thank you so much for your help today. Thank you, doctor, and I hope to see you soon again. Now, before we finish this case, guys, I do want to give you a couple of tips. Of course, it's easy for me to be doing the case because I'm just doing it as a video. When you're actually talking to the patient or to a doctor, you need to make sure that you have eye contact. Therefore, having a lot of OSCE practice so that your body movements and your actual communication skills that are in person can be assessed are really important. So definitely try to go ahead and do as many OSCE mocks that you can, if possible in person, if possible on video calls, and try to keep reading out references that you don't know per se, right? Just to kind of have a little bit of an idea. Practitioner or any sort of healthcare provider. We are taking some slots for OSCE practice at the moment. My slots for EE practice unfortunately are all full, so I'm not able to do EE mini mocks at the moment. But in case you guys are interested in doing PEBC OSCE practice, do definitely reach out to us. Our AceOSCE and all our reaching out links are in the description below. Hopefully this video helps you out. All the best, and let's keep the revision going.